Hello friends, welcome to Gyno Talk. I am Dr. Safina Anas, laparoscopic gynecologist at Asta Hospital, Dubai. Today I will discuss about cervical cancer screening. Pap smear is a procedure for the screening of cervical cancer in women. It involves collecting cells from the cervix, which is the narrow lower end of the uterus. Is pap smear useful to you? Sure. Pap smear help in detection of the cervical cancer early so that there is a greater chance of cure. Pap smear can also detect changes in your cervical cells that may develop into cancer in the future. Detecting these abnormal cells early is your first step in halting the possible development of cervical cancer. Who should have a pap smear test? Your doctor can decide when it's the time for you to begin the pap smear testing and how often you should have the test. In general, doctors recommend beginning of pap smear screening at the age of 21. How often pap smear should be repeated? It is recommended to do pap smear every 3 years for women ages 21 to 65. In women older than 30 years, pap smear may be combined with a test for human papillomavirus or HPV, which is a common sexually transmitted infection that can cause cervical cancer. Women aging 30 years and older, they can consider pap smear every 5 years if the procedure is combined with the HPV testing. If you have certain risk factors, more frequent testing is recommended, regardless of your age. These risk factors include diagnosis of cervical cancer or pap test that showed precancerous cells, HIV infection, smoking and immune deficiency. Then about the procedure. Your doctor will gently insert a speculum into your vagina so that the doctor can easily see your cervix. Then the doctor will take samples of cervical cell using soft brush. This usually does not hurt. And after the test, you can go about your day without any restrictions. Now, when you can stop the pap smear testing? If you have undergone a total hysterectomy, that is the surgical removal of the uterus including the cervix for a non-cancerous condition such as fibroid uterus, you may be able to discontinue the pap smear. But if your hysterectomy was for a precancerous or a cancerous condition of the cervix, then your doctor may recommend to continue the testing. Old age. Women older than 65 years can stop testing if their previous tests are negative. Discuss your options with your doctor and you can decide what is best for you based on your risk factors. Thank you and see you next time with another topic.